everyone, it's Alicia, and today I'm here with Dr. Bilski of Bilski Dental Group. How you doing today?
I'm feeling good.
Good. So in this video, we are going to be talking about the importance of dentistry for people who are older adults. You know, they're maybe 75 and up, and we're just talking about how important is it for them to continuously be going to the dentist.
So that's a good point, or good question. In general, the research out of the American Dental Association and a group of periodontists, which are specialists in the gum and the bone of our mouths. 75 years and older, the recommendation is to come in 4 times a year, every 3 months. Now, when we talk about that, what does that actually mean? I'm not saying when you're 75, now you start coming every 3 months. So it's the chronologic versus what is we're actually seeing. I have some 45-year-olds that have mouths that look like they're 85. So we're going to recommend them coming in 4 times a year, maybe minimally 3 times a year. And that's a suggestion. That's based on recommendations in the research. We have a lot of 82-year-olds, my mother. I see her 4 times a year because she's my mother and I love her and I want her to have optimal oral health. Come on in. And we have other patients that are just as healthy and they're close to 90, and it's good to see them, and they do follow the recommendations because they understand as we get older, it's best to be seen more often in the dental office. This means we can see a cavity starting sooner, because when you are 85, maybe you're on some medications that typically dry your mouth. When you have dry mouth, reduction of saliva, that's a buffer of the acids that build up in our mouths when we eat. And those little bugs like to chew on our roots if we have recession. And then that's where we get the root caries or root decay that ends up with either root canal or we can't fix it. So when you're older, you typically don't feel that. When you're younger, at 20s, young 30s, you bite into that Snickers bar or donut or drink your sugary drink, and you feel it. So you don't feel that when you get 55, 65, 75, 85. So it's just a precaution or preventive measure that we talk about with our patients, and it's a suggestion. We send it out in our literature, we talk about it on our blogs.
And that's really what this video is about, just knowing that, you know, when you reach a certain age, don't just think, I don't need to go to the dentist anymore, I did it my whole life, my teeth are fine. There could still be stuff going on, and you want to know that.
Mayo Clinic did the research. Those that have their teeth later in life, on average, live 10 more years.
Wow.
What that means is also quality of life goes up. Why does quality of life go up? Inflammation in the mouth goes into your arteries, affects your heart, or the inflammation goes to your brain. So now you see more dementia, more stroke, cardiovascular problems. And certainly diabetes is in there too, and there's about 4 or 5 other things that you wouldn't think about. And we're just trying to help. My part is to take everything that's inside as this 3-inch opening, and then that is the highway to potentially optimizing your total general health as well. So are we saving the world and the planet? Possibly.
There you go.
I like to feel that we are, but we also understand that patients have or want what they want. And if they feel that it's okay, some people just say they don't worry about it. And if they have to have their teeth removed, or they'll deal with the inflammation, and if they get cardiovascular diseases or strokes, and they're okay with that.
I know that it started there, but it could have had something to do with it.
And not to bang that drum and be such a downer on it, but that is what the research is absolutely showing us. And there's a nice video out there on YouTube that, you know, you go to our website, it's up there, you can look at it. It's just how inflammation works on our body. And if you're older, we'd like to see you more. I hope you take that as a good piece of advice.
Wonderful. Well, thanks for talking to me a little bit about that today. I think it is important to know. And if you would like to schedule an appointment with Dr. Bilski, you can give them a call, or you can visit online to just find out some more about what it's like to come to your practice and the different services that you offer. So that is bilskidental.com, and they're looking forward to talking to you soon. Thank you.
You're welcome. Thank you.